Welcome back to Capital Review. So in the past year, fear, anxiety, and stress were all emotions felt by every single member in the family. But oftentimes, it's difficult for a child to navigate through their own emotions. And that's why joining us now is Rachel Wisthuff, the Assistant Director of the Public Policy and Advocacy Department at UNICEF USA. Rachel, thank you so much for being here. So we can only imagine what kids have been dealing with. But what have you been seeing? How has the pandemic affected a child's mental health?
Yes. So last year, UNICEF reached 47 million children, adolescents, and caregivers with community-based mental health and psychosocial support in more than 100 countries. But there's still millions of more children out there in need of support. And I think it's important to note that before the pandemic, it was estimated that mental health conditions affected 1 in 8 children between the ages of 6 and 18. And mental health disorders manifest themselves in children before the age of 15, typically. So earlier this year, UNICEF saw that, the millions of children that were under stay-at-home orders were really having their mental health and well-being put at risk. And oftentimes that was because children were experiencing increased risk of violence or neglect, with being trapped in their homes with their abusive caretakers, or it was just increased socioeconomic pressures being put on families themselves. And so lockdowns left children without their usual means of support, whether that's through schools or peers or family friends.
Rachel, we know it's hard for a child to communicate how they feel, especially if they themselves don't understand what's even happening to them. So what are the signs to be aware of when a child may be experiencing emotional and mental distress?
It's a great question. And to preface this, I'm not a clinician, but UNICEF has consulted with many mental health professionals during COVID to generate advice and supportive means for parents and family members that are navigating the situation. And we've all seen disturbing reports on the rise of mental health challenges during COVID-19. So I think first and foremost, it's important to just check in and listen. Signs of mental health challenges manifest themselves in many different ways. That could be through increased anxiety and depression, behavioral changes, or increased substance abuse. And children, in particular, very young children, oftentimes take their social and emotional cues from the adults in their lives. So it's really important for adults to remain calm themselves and listen to their child's concerns. Let children be the ones to carry the conversation and lead the conversation and validate all of the emotions that they're experiencing. So there are a lot of means that we can take to collectively invest in children's positive mental health. It doesn't always have to result in negative mental health outcomes. And I think we can do that collectively together.
And Rachel, aside from caretakers, what are other healthy solutions for teachers and communities to say and do in order to alleviate the stress that a child is feeling?
That's also an excellent question. Particularly with teachers, there are ways to build safe spaces into classrooms. A lot of times children have experienced COVID differently and they're coping in different ways. And so some children might find relief in creative expression, others through physical activity or re-engaging with their peers. And oftentimes it can help for teachers to actively seek suggestions from children on how to create that welcoming, safe classroom in line with the school safety procedures. So that's one recommendation. I think it's also important that children have access to credible information on COVID-19. I think a lot of times adults fear perhaps putting too much of a burden on children with this information, but as long as it's child friendly and age appropriate, it's definitely something that collectively we want to talk about with children. And then finally, it's really important that community workers, parents, teachers, everyone practice self-care themselves, and don't try to hide anxiety and stress that might be manifesting itself, but be open about the fact that this is all taking a toll. And I also want to mention UNICEF Kid Power. It's a free online video platform that supports the mental health of participating students by allowing them to empower themselves and in turn helping others. It's a collection of 3 to 5 minute videos that feature either physical activity or social emotional wellness. And it's designed so that children help to identify their own emotions and build resiliency. And by watching these videos, they're actually supporting UNICEF's global impact and finding ways to connect with local causes, so that not only are they lowering anxiety levels in their own brain, but by helping others, they're helping themselves.
Definitely a great tool to have. So happy that we learned that. Rachel Wisthuff from UNICEF USA, thank you so much for being here and for your time.
Thank you. Appreciate it.